Welcome to Health Reform 2.0, the only place on the internet for people with a curious mind and a desire for a better healthcare system. Here we take you on a journey of our current quagmire, tell you where it came from and why the government can't fix it. Along the way, we'll tell you some history, bust a few big myths, tell you a few stories, and give you an idea how we can work together and get the healthcare system we want. Let's get started.
Hello, everyone, and welcome back to Health Reform 2.0. My name is Tim Henning, and as many of you know or may be aware, we have been a little tardy in getting out our next episode. So I wanted to explain why, and thank you for your patience. On June 27th, my co-host, Tom Loker, had a major heart attack, and we almost lost him. I was out of town when this happened, and it took Tom's wife, Teresa, a few days to track me down over the 4th of July holiday. When Debbie, my wife, and I visited with Tom after giving him some time to recover, we were amazed the story he told us, and taken aback by his near-death experience, as well as what he has experienced and is still experiencing with our healthcare delivery on a first-hand basis. After some much-needed recovery, we met again and decided to make this next episode, episode 8, around Tom's MI. His near-death experience, his experience in the ICU in the hospital, and now the experience with his recovery. So welcome to episode 8, Serious as a Heart Attack. Please welcome my co-host, Tom Loker. I am sure happy to see you and witness your recovery. I thought there for a minute I was going to have to find a new co-host. You scared the crap out of all of us.
Well, it was just a devious plot on my side, Tim, to try and get into the healthcare system and to be able to report on what's going on. Obviously, that is not the case. I am very happy to be here. It scared the crap out of me as well. As you know, I had no indications that there was going to be a problem. I have relatively been in good health, work outside all the time, walk, do all those great things. And it was sudden onset and shocking to me as well.
Yeah, shocking to everyone, and it was quite the time. So, Tom, as you know, what you had is what we refer to as the widowmaker. We call it that because most people do not survive this type of occlusion or blockage. I think your doctor indicated about 50%, if I'm not mistaken.
That's exactly what he said, about a 50-50 shot.
And we have a graphic which helps explain this type of occlusion or blockage. This occurs when the left main anterior descending artery is blocked, cutting off blood flow to the entire front wall of the heart. Now, I spent a great deal of time in the cath lab, and I can tell you that you had the mother of all heart attacks and survived. Now, thanks to your very intelligent and cool-headed son, some very good work by the paramedics, the ED team, the cardiac cath lab team, and your cardiologist. It's an amazing story. So, Tom, do you mind telling us just what happened that day on June 27th?
Well, it was interesting. I had been working, actually editing the earlier podcast and setting up to edit the next podcast, which was number 7. And my son asked if I wanted to go see Jurassic Park with him in the afternoon, and he was home from college. So I said, okay. We'll go off to see this movie. Felt fine, no problems. And as we were walking into the movies, I started to feel some pain in my chest, started to radiate down my arm. And I think walking in the theater, I started feeling in my chest this white hot pain. It was starting to shoot down my arm. It wasn't severe yet, and I thought, well, let me go sit in the chair in the theater, see if I can relax and see if it will pass. So we got in the theater, we sat down, and for a few seconds it felt like it was subsiding, and then it came back even more, crushing with a vengeance. And I knew at that point in time I was in trouble. So I told my son, I don't think we're going to get to see this movie. You're going to have to drive me to the hospital. So we walked out the door. As I was walking up the theater and going to the car, it was getting worse and worse. We got to his car. My son took a look at me and said, "I'm not driving you anywhere. I'm dialing 911.
Smart.
Yeah. Normally, I would have probably argued with him. But in this case, I figured out that he was right. And he was cool, calm, and collected. He dialed 911. They were there inside of 3 minutes. He was there the whole time, keeping me calm and trying to help. And then it started from there. They gave me, I think it was 6 baby aspirin to chew. They gave me nitroglycerin sprayed under my tongue. They started an EKG. They opened a line in my arm, in other words, an IV, and I started to feel a little better. In fact, I remember asking the tech if I could see the EKG, and he showed it to me, and I said, "I don't see anything wrong." And he says, "Well, I don't either, but all of your symptoms say you're having a heart attack." So
this is one of the reasons the EKG doesn't do much for me.
They took me to the ER at the local hospital, San Ramon Valley Hospital, and took me into the room. And a few minutes after I went into the room, I went into cardiac arrest. My son and wife were there at the time. They were hustled out of the room. I had flatlined, so they started chest compression, CPR, and then began to shock me. And I remember the guy jumping up on the counter on the table to start compress my chest. I remember the first shock. I don't remember anything else until the last shock, which was like way more powerful. I remember literally jumping on the bed, felt like I jumped up off the bed. I originally thought there had been 3 or 4. When I was visiting the ER the other day, they said, "No, you had 7 shocks, 7 tries of bringing you back." And in between each of those, my friend who was beating the crap out of my chest was up on me, trying to get me back. And it was an interesting experience, to say the least.
Can I ask you a personal question?
Sure.
Did you see the bright light, or did you hover over yourself?
I didn't hover over myself. I didn't see a bright light. In fact, I told a friend of mine when he asked if I saw the pearly gates, I said, "Yeah, I must have. I saw this bright white light and this big, strong guy jump up in my face and start pressing on my chest." I did have a period where after the first shock, when I was flatlined, when they weren't trying to compress me or shock me, where I was in a nothing state. I wasn't unconscious. I was fully conscious, but I had no sense from any of my senses. No sight, no feeling, no sound, no nothing. And it was weird because instead of passing out where there's nothing, I knew I was there. I just didn't know where I was and had literally no other stimulation.
That's interesting. So they did. That's remarkable because I think they hit you with all the jewels on the last time, if I'm not mistaken.
Yeah.
Did they go straight to the cath lab then?
Yeah, and I have a sketchy memory at that point. I was kind of popping in and out of consciousness. They took me into the cath lab. I vaguely remember getting in there. I remember being talked to. I don't quite remember the conversation. I do remember in the cath lab, they were going to do an angioplasty, insert a balloon, and expand the area where the clot was. I remember throwing up in my oxygen mask and thinking that's not going to be good. And of course it wasn't. It caused a problem in the lungs, which is called aspirative pneumonia. And my lungs began to bleed from the acid and create a lot of fluid. I remember them intubating me after that vaguely, but I don't remember a whole lot of anything else, little bits and pieces, but I can't put them together in time. But I do know that when they were doing the angioplasty, inserting the balloon, the equipment failed. And fortunately, I was told later that my cardiologist, Dr. White, who has been around for a little while, he's an older cardiologist, he's not a young whippersnapper. When the equipment failed, because of his prior experience with older equipment, he was able to estimate how much farther the balloon had to go in the vein to be able to be inflated and inflate the clot. He did that successfully, but the equipment was dead at this point.
Let's talk about that in a minute.
All right.
This is an example of how things can go wrong, right?
Yeah.
I know that piece of gear very, very well. It's an FD-20-008. It's probably the number one sold cath lab in the world. A motor failed, and when that happens, you lose the ability to get any type of angle, and probably lost fluoral too. So what he witnessed was the fact that he knew how far away he was, and he just estimated by, I think, I'm only estimating, so thank God they had fluoral for a while so you could get that thing opened up.
Right.
And then I think they put a heart, what was the pump they put on your
an impella, but that didn't happen for about 30 hours, 25 to 30 hours. They kept me sedated, is what I gather, what I was told the other day, and made arrangements to transport me to John Muir Hospital, which is 15 miles maybe away, maybe not that far. So they transported me, they kept me overnight at San Ramon. I'm assuming in the ICU, but I'm not sure. The next morning they transported me to John Muir, and Dr. Brown, Dr. White's partner, took me to the cath lab there, and they inserted 2 stents, and then they inserted a pump that is called an impella, I-M-P-E-L-L-A. We have a picture of it, into my heart. A phenomenal piece of equipment. It shows where we've come technologically. And they inserted that into the heart to help assist the heart in pumping, take the strain off, so the tissues wouldn't be as damaged, and the muscle tissue would have a chance to recover before it became permanently damaged. And like I say, they inserted 2 stents, and then I was transferred to the ICU and was in the ICU for a couple of days.
Well, I can say is that 15-mile ride from San Ramon to Walnut Creek, that was a hell of an Uber bill you got.
Yeah, we haven't gotten our EOB yet, but we did get a notice that the transport was not in our network, and the bill for the transport was $9,000. And if the insurance company still refuses to cover it, then our portion of that's going to be $6,500. My wife was rather upset when she was told this, called the people and said, my husband is basically being brought back from death. They're telling me he needs to be transported. Who in the world is responsible for telling me that the transport is out of network? And if it was I supposed to say no? So it just highlights the amount of the problem that we have in the administrative side of our healthcare system.
Yes, that's a great example. And you would never know if they just did it, and now you got to go fight for it.
Right.
Along with some other things that are going on. So now you get stabilized. We do the angioplasty. It's opened up. You're going to spend some time in the ICU again at John Muir, I assume.
Yep.
So when they insert the catheter, ladies and gentlemen, it goes into the artery out of the leg, the femoral artery, I believe, with the catheter. Had a little problem there. Talk a little bit about that. Talk about what you witnessed when you were in the hospital. I think you finally went to a step-down unit a couple days later, right?
Yep.
Talk a little bit about what you saw and what things kind of jumped off the page at you as being an educated healthcare consumer, now watching it from the inside out.
Well, the first thing that jumps out at me is I wasn't conscious, at least the first day in the ICU. They still had the cardiac assist pump, the Impella pump, inserted in me that was still running up the catheter in the leg. Sometime in the early morning of my second day in the ICU, they made the decision my heart was recovered enough that they could pull out the pump. I don't know the exact time yet. I'm trying to find out. But the second day in the ICU, when I started to become aware of what was going on, it was out of my leg by then. Shortly after that, maybe 4 or 5 hours as a guess, sometime around 9 or 10 in the morning, the nurse that came on shift at 7:30 followed her protocol, which said they needed to get me out of bed. So they did. They asked me to stand up. They helped me stand up. When I was standing up, I felt something pop. Because when they pull out the catheter and the sheath, you have a hole in your artery. Mine, by the way, was above the femoral. It was in the iliac, at the root of the iliac, so it was a little higher. But there's a hole. And because of the size of the pump, it's a little larger hole than would normally be for a balloon catheterization. But they have this high-tech sealant that is a foam that they put on the artery that actually is supposed to seal the artery and seal the hole with this little expanding plug that puts everything right and stops the bleeding so that then you can go into recovery. Then they put a couple of stitches in. When I stood up, I felt something pop. I wasn't sure what it was. I still wasn't 100% off of any kind of medication. I had only had my breathing tubes removed maybe 30 minutes to an hour before. But when it popped, when I got back in bed, I noticed that there was blood on my leg, blood on the sock, and blood on the floor. The nurse said, "Oh, looks like something bled a little bit." They applied pressure to the wound. It resealed, it stopped bleeding. And of course, I was back in bed for the rest of the day. So later, that is going to show up as a problem. It showed up as a problem about a week and a half after I got home because the hole in the artery didn't seal. And what I've ended up with is called a pseudoaneurysm, where the blood is pulsing out of the artery into surrounding tissue. It's created a pocket. And it just pulses back and forth, and that balloon of the tissue swells up. And then I had to go back into the ER last Monday and into outpatient surgery on Tuesday where they tried to repair it. I will find out in the next couple of days if the repair was successful. If the repair isn't successful, then I'm going to have vascular surgery where they will actually open up the leg and directly work on the artery and reclose the artery and stitch it, which is what they did in the old days, by the way.
Yeah, that's exactly right. So another byproduct of a procedure that's having repeat consequences after the fact.
Exactly. And it's a great example of how the same technology that has so greatly enhanced our medicine and enhanced our ability to survive these things does come with technological challenges and problems. And this stay in the hospital, when you and I were talking when your wife was here, we characterized as both the best and the worst of changes in medicine. And in many cases, they're exactly the same thing. The benefit is coming with more risk, and the likelihood of the problem and the risk is becoming higher than it was in the old days with older procedures. It is less invasive, it is less painful, it will reduce your stay in the hospital, But it also has the problem of if it doesn't work, they're going to have to go back and fix it, which is a readmit, which they don't want to do because they get penalized for it. Right. And then they go to great lengths to keep the readmission to the hospital down. If the low impact solution that they did last Tuesday works, it was a good thing. If it doesn't work and I have to go back into the hospital, that's going to be a bad thing. So on one hand, it's supposed to lower your hospital stay, but if those two processes fail, the sealant and the repair with thrombin, if those two things fail, the vascular surgery is going to be a significant surgery and require another readmit and stay in the hospital. So it is the best and worst of medicine and technology that I experienced. Another thing that I experienced was one day my nurse was pulling up my medical record to determine what I was supposed to get in terms of medication. This was in the step-down unit. And when she pulled up the medical record, she recognized that it was putting up the wrong medications. She had been treating me for a day before. It was the same nurse. Well, she was there the early shift on one day and back on the early shift on the next day. So she knew basically what she'd already given me around the meds. She knew what they were. And when this came up, she goes, for some reason, Mr. Loker, I'm seeing a whole different set of meds. And she started to read to me what they were. And they were the meds that I reported to the hospital I was taking when I was in the ambulance coming in. So somehow or another, the electronic medical record glitched and was giving her the wrong information. But because the nurse was capable and knew my case, she was able to understand it was wrong. She went out, she got the right meds, and then a little bit later, the record cleared itself up. But again, you and I have talked about this before. Electronic medical records are tremendous in their potential, but they also bring with them significant risk. If she had given me the flecainide, which is one of the drugs, it would have impacted with my other drugs they were giving me and very likely killed me. So it is the technology we're bringing to the table is phenomenal, but it is coming with its own risks and liabilities. And in many cases, those risks are showing that it's a bigger problem than a benefit. In fact, electronic medical records recently were reported to be increasing the risk of healthcare significantly.
We talked about this. I can give you numerous examples of this. I won't because it will point back to particular systems and medical systems. But here again, the human factor couldn't be replaced.
Right.
She recognized that, right? Same thing, the human factor couldn't be replaced because your doctor was smart enough to know where to put the balloon and not need the technology.
And he wasn't a younger doctor. He had actually worked with equipment in the old days that didn't provide anywhere near what this technology does. And later in the ER, when I was going in for the aneurysm, one of the people that had worked in the cath lab was there with me. Actually, there were 4 or 5 of them that had worked in the ER in the cath lab when I came into the San Ramon Hospital. And they all said, you're lucky you had Dr. White because he was able to deal with this where some of the younger doctors would not have been able to. They didn't have the experience and the skill.
Yeah, unfortunately, I've been in those situations. I was a field service engineer at a very young age for high-end imaging equipment. When things go wrong, they would go really bad.
Right.
And if you're in there and you got a patient, I explained the day I saw you, the cath lab that broke down years ago where I had to climb on top of the table and hook up the optics and the patient almost bled to death.
Right.
This happens. This happens, unfortunately. With electronic medical records, the same thing. These glitches occur. All of a sudden, the electronic medical records say you were in the hospital. The next minute, it'll say you've been discharged, and you're still sitting there.
Right.
I've seen that happen many times. Overall, though, the experience was fairly good. I'm really glad that the nurses could spend their time giving you ice chips. That makes me really good. Nurses to the rescue is one of our episodes.
Yeah, the thing that's interesting is the nurses are there to help you. But they're critical to your care. And they, one of the things they do is say, would you like some ice chips? Would you like a glass of water? and it's lovely that they do that. I enjoyed the ice chips, but I also recognized that every time I asked her to get me ice chips, she wasn't available for something that could happen with one of the other patients that she was taking care of. And I don't know the number. I believe it was 3 or 4 that my nurse was monitoring in their rooms. The other thing is every time she would do something with me, if it took 10 minutes, she had 15 to 30 minutes of charting that went along with it. One of the other experiences that I had was a patient that was, I think, across the hall from me, who was difficult and demanding and abusive of the same nurse that was treating me. And it's just, you look at the situation and you look at what nurses have to accomplish and some of the things they do. We just don't understand that they play a very critical role in care. And in many cases, they are more engaged in the treatment of a patient than the doctor themselves. The doctors do the diagnosis, they do the surgeries, they do the things that require mechanical intervention. But by and large, the nurse is the one that is gathering the information, observing the patient, paying attention to what's working, not working, driving me crazy about eating food, which was a requirement for me to get out of the hospital, which I had little to no appetite. They had given me 28 pounds of fluid to increase my blood pressure and 2 units of blood during the process. And as a result, I was from, my normal weight is about 190 pounds, 185. And when the day they released me from the ICU to take me to the step down, I was 228 pounds.
Yeah, you kind of look like Elephant Man there in the legs.
Yeah, and there was swelling, and it was hard to breathe. And of course, there was so much fluid, there was little room in my stomach. I think I told you I had one little cups of Jell-O. I couldn't even eat the damn Jell-O. I ate a little bit of the Jell-O, and I was just completely full. The other thing is, without, the food's terrible. You're on a cardiac diet. And the food is unappetizing. It tastes like hell. And, between that and the medications, fentanyl and other things that they give you, your appetite gets suppressed, but they have to push you to eat, because if you're not eating and you haven't had a bowel movement and there's not bowel sounds, you're not getting out of the hospital.
Yeah, that's right. I think people need that's very true, ladies and gentlemen. Very true.
So even if you have to fake it, fake it. Eat a little bit here and eat a little bit there.
Yeah, I remember I had my appendicitis, which was nothing compared to you. I couldn't get out of there until I could urinate. That was bad enough. So,
oh yeah. Yeah,
it's tough. I know we have some graphics that we're going to put up showing the pump and the Widowmaker, and then of course what they did to fix it with the angioplasty. Did they put a stent in? I think they did.
They put in a stent, but it's actually 2 stents to cover. Covers the one occlusion.
Yeah, not uncommon. One of the things you want to talk about that were positive and things that areas for improvement. We covered quite a bit.
Yeah. Well, the stuff that was positive was technology was phenomenal in that one respect and a huge risk in the other. The sealant, I think, when it works, is a tremendous benefit, but when it doesn't work, it's a problem. Obviously, the failure of the cath lab machine in the middle of the procedure, and I heard after the fact it took them 2 to 3 days to get that equipment back up and running. The response of the paramedics, they were fast, and the actions of my son and the paramedics saved my life. If they hadn't been there fast enough, I would have arrested in the ambulance. If my son had listened to me and tried to drive me to the hospital, I would have arrested in the car, and I don't even want to think about that.
That's why no one ever listens to you.
Yeah.
But the interesting thing about it is, and it was the right call by your son for sure, cool-headed, didn't panic. The good news is that fire station is very close to the movie theater, if I remember.
Yeah.
So it's a good thing. Hospital's probably 5 miles down the road?
Yeah, about that. 5 miles, and on a bad day it can be 15 or 20-minute drive. So
I got a feeling if that would happen to me up at the mountain house that week, I wouldn't be here today.
Yeah, well, hopefully that wouldn't have been the case, but it and I had no indication before that there was a problem. I had been diagnosed with AFib a year before. I had had a full cardiac workup. There had been no sign of any kind of significant plaque or any problems in my heart or my vessels. And, basically that was March the year before. And here we are in June of this year, and I end up with a fully occluded artery. So it was amazing. The cath lab personnel and the emergency room personnel, like I say, I didn't remember a whole lot of them, but when I went back last week for the diagnosis of the pseudoaneurysm of the iliac, a bunch of people came in, about 5, who were working the ER and the cath lab when I was there. And basically they all told me, when I was there, most of them did not think I was going to make it. So they were surprised that I did. But more than that, as I started to understand from various people what they did, they were highly professional. They knew exactly what they were doing. They were right on it, and they did a wonderful job.
Yeah, that goes to show you that the great part of healthcare, the great technology that sometimes doesn't work, but more importantly, the human factor, because these people are highly trained, they know what to do, and you had to be in the right place at the right time.
Exactly.
To me.
And
so
let me also mention my cardiologist. I mean, both of those guys, Dr. White and Dr. Brown, Dr. White has been practicing for 25, 30 years. He's highly experienced. Dr. Brown is a little bit younger, but he has, I think, 15 years experience. And, they knew exactly what they were doing. They knew how to use the technology to the best of their ability. And they were superstars, both with their skill, but also their bedside manner. And one of the things I can't stress enough is you have to be an educated consumer. You have to understand what's happening, and you have to be able to understand what they're saying. They were very good at speaking to me, and I think would be very good speaking to anybody. But you and I have talked in health reform, we need to get a facilitator. I hate to think what would happen to a patient that didn't have some education in healthcare. Trying to understand what was going on, understand the risks, and be able to deal with this. And I'm fortunate that I have spent some time in this and learned quite a bit. But, this idea that we've talked about getting a facilitator that can be a person that helps the patient understand what's going on, help them understand the ramifications so they can make a decision, and help communicate with their physician and their insurance company and anybody else that they have to deal with, I think is a vital role. I had to pay very close attention as I started to be able to pay attention to what was going on and ask good questions, or else there was a series of things that might have gone a different way. So
I think that's a very good point. And with that, just one more question. We've got to get this aneurysm thing taken care of, which tomorrow you'll know more about that.
Right.
You already went through some at-home rehab. I don't know if you're still doing that. What's next after we get this insertion site rectified? Cardiac rehab?
Yeah, I was supposed to have started cardiac rehab on Tuesday of last week. Of course, Tuesday of last week, I was in having them try to repair this pseudoaneurysm on the iliac. I did have at-home rehab, but it stopped because on the prior Friday, because they expected me to be going to cardiac rehab. Because of the pseudoaneurysm, there's things that I can't do because of the danger of it expanding and rupture. I can walk up steps, but I have to walk up steps. It's on my right side, so I have to lead with my left foot and take a step at a time. I can exercise a little bit, but I can't do strenuous walking because that can also cause a problem. So, the issue is if tomorrow I find out the thing was sealed, then I can begin cardiac rehab next week. If it isn't sealed, then the question is, can I even do cardiac rehab, or is that going to cause a problem? And then the next thing is, if I need to have vascular surgery, I may not be able to have that for 3 to 4 months because of the blood thinners that I'm on. So I don't know the answers to these things, but
or could it be because of the readmission?
Could be. There was a benefit to them trying the minimally invasive solution to fix it. And you know me, I've looked it up. I've looked at all the information, and it is an option that works some of the time. It may have worked in my case. There's reasons to think it hasn't, but again, we'll find out tomorrow. And if it hasn't, then I'll have the vascular surgery when all the doctors agree it's the right time to do it.
Yeah, I did some research as well. When I was in the cath lab, we didn't have those pumps. It was a simple cut down and catheter. So I was kind of taken aback by the access point until you described it to me. So a change in the approach, a change in technology, which, by the way, is great. Yeah. Just to have a little bit of a repercussion now of where that thing was inserted. So we wish you the best tomorrow. It's great to have you on the show. I'm so glad that it was great. We went to Tom got us tickets to a special concert the other night, and I was glad he could be there. It was wonderful, and it was great to see you there. Glad you're back. Any last words before we sign off to the team here?
The only last words is to tell people that pay attention to your body and pay attention to what it's telling you. There's 3 or 4 symptoms of myocardial infarction, a heart attack. There's sweating. There is shortness of breath. There is another one could be a feeling of indigestion or dizziness. And then, of course, the one that's unequivocal is the pain, the radiating pain in your chest. When you start to have these things, you can't wait. You need to immediately call and get somebody there. Call a rescue squad, call the ambulance service, and have someone come. Because the ramifications of time are something you're not going to be able to deal with. I'm very lucky to have survived this, and it's because of the benefits of the medical system. And while you and I talk a lot about where healthcare needs to go and things need to change, and there's plenty of examples of that in my experience, what we also talk about is the quality of physicians, the quality of nursing, and the quality of the technology and how it has really helped change healthcare. It has. So, I am blessed to have been at 2 good institutions, had tremendous healthcare, and lived through this experience. But if you don't know what's going on, find a friend that may be able to help you and just talk to the doctor and make sure you let them know to update that friend who can help update you. If you do understand what's going on, if you're an educated consumer of healthcare, you're in a lot better position because you can ask questions and push when they present you with one alternative or another. You can push a little bit to go after one you may want to do that might be better or might be riskier, and may bring a better result, but at least you're making an intelligent decision.
Yeah, I agree. I guess I'm guilty because I find that most of the people that have been in the healthcare profession, at least my experience has been, at least I tend to ignore these things sometimes. So good advice. Well, thank you. Glad you're here. We got a lot more to do, and we're back on track.
I look forward to it. So thanks, Tim, and we'll keep going and start working on some other shows.
Great.
See you.
Thanks, everybody. Take care.
Bye-bye.
You've been listening to Health Reform 2.0 with your hosts Tom Loker and Tim Henning. We hope you found the topics interesting, that we answered a few questions, that you laughed a bit and were entertained. Please feel free to invite your friends to join the discussion, and remember, hit that like button and don't forget to subscribe. Send us your questions to info@hr-20.com. We hope to see you again next time.